back to our channel, Your Health Are Concerned. My name is Patience from Asset Pharmacy. Today is World Asthma Day, and the theme for this year 2022 is Closing Gaps in Asthma Care. I've heard so much about asthma and see people managing asthma. Farm Charity and Farm Units are here to educate us more about asthma. Please, Farm Units, go ahead.
Asthma is a chronic disease condition. It is a disease condition of diffuse airway inflammation, and it is caused by a variety of triggering factors. This variety of triggering factors now result in bronchoconstriction. The bronchoconstriction can be reversible, and the reversibility can either be partial or complete. So what I'm trying to say is that in asthma, there is an inflammation of the airways leading to in the lungs, and this inflammation of the airways is actually the linings of the airways that is inflamed, and when it is inflamed, the airflow in and out of the lungs becomes limited. Now the limited air inflow or outflow of air also is due to chest tightening. The chest becomes tightened, the lungs, the airways become so tightened that the flow of air is impaired. And when the chest is tightened, there is further hyperreactivity because it actually is not functioning as normally as it should be. And definitely when it becomes tightened over time, remodeling of the lungs occur in form of the mass of the lungs, the shape of the lungs, and so on and so forth. Now, what are the symptoms? We have talked about generally about asthma. What are those specific symptoms we should look out for, or signs that we should look out for to show that somebody is actually asthmatic? We see that the person coughs persistently, especially at night. There is wheezing, and there is shortness of breath. In some cases, it is known as apnea. How can asthma be diagnosed? How can one know that this thing that is happening to me is actually asthma? Well, there are genetic factors like family history, so to speak. If in the family there is a genetic trigger, there is a genetic factor responsible for causing asthma, it can be inherited. So in essence, I'm saying the asthma can be passed on to the next generation. Environmental factors still can result in asthma. And another way that asthma can be diagnosed is through pulmonary function tests. So I said environmental factors, family history in terms of genetics, or pulmonary function test is a way to diagnose asthma. Talk about the risk factors to asthma. Like, what are those things that predisposes one to asthma? One of it is prenatal factor. By this I mean like circumstances surrounding birth or after birth, like circumstances that surround the birth of a child or circumstances that occurred after the birth of a child. And this is usually a factor when it starts from about 20th to 28 weeks before the birth of a child, or it can extend to 4 weeks after the birth of a child. So factors surrounding those time periods can actually make a child to be at risk of developing asthma. Another is environmental factor. Environmental factor, as the name implies, are circumstances in the environment that can trigger an asthma attack. And this can be pollens, like pollens from flowers. In some cases, when people inhale pollens, they are at risk. It triggers a reaction, and asthma can occur. In other cases, reactions to insects, cockroaches, mites, and other things, even dust in the environment can be a trigger. The third factor is respiratory infection. A viral infection like respiratory syncytial virus can actually cause asthma. Then another factor is genetic factor, like hereditary factor, so to speak. So asthma can be inherited from a parent to a child. Then the last factor is medication. Medications like aspirin or other non-steroidal anti-inflammatory drugs can actually trigger asthma, or is a risk factor in development of asthma. So the treatment of asthma can be done basically in two ways. One is by controlling the triggers. So those factors, the environmental factors and the rest that I made mention of, if they can be controlled, the occurrence of asthma can also be controlled. Another is the use of medications. But my colleague is going to tell us more about this treatment, especially the medical aspect.
Thank you, Faminis. So today I'm going to be talking about medical treatments for asthma, and I just want to include that these medical treatments are usually recommended strictly by doctors or pharmacists, and if you think you may be experiencing any of the symptoms my colleague had mentioned earlier, please seek a professional advice or you visit your physician to get this medication. So the purpose of mentioning this treatment is so that you are aware about the treatments for asthma and also other things we need to learn aside from the medical treatment too. Thank you. So I would like to begin with inhaled corticosteroids. So these are drugs that are long acting. They are long-term anti-inflammatory agents that help to reduce inflammation in the bronchos, that's in the lungs, to help or to assist air passing in and out easily, and also to help reduce excessive mucus production in the lung so that the patient can get a better inflow of oxygen in and out of the lungs. So under this class or group of drug, we actually have drugs like budesonide, or drugs like the beclomethasone. There is also the very popular one, the flixonis, that is the fluticasone. Sorry for that. Yeah. The fluticasone drug. So these drugs are actually given to patients, and most time alone or with other asthmatic medications. So the first class of drug I'll be talking about are the inhaled corticosteroids. So these are usually found in inhalers, and they are long-term therapy given to patients to be used every single day. So they act by reducing inflammation caused in the bronchos. That's inflammation, that is pain, and also redness, swelling in the bronchos that reduces the flow of air in and out from the lung. They also assist to reduce mucus production in the lungs. So after using this corticosteroid, you get relief from coughing and also from breathing. So these corticosteroids, includes the flixonis, the very common one, fluticasone. It also includes the beclomethasone, and also lastly the budesonide. This inhaler is said to be used daily, and like I said, they are mostly inhaled. That is, they are compacted in an inhaler. So after every single use of this inhaler, you are advised to rinse your mouth thoroughly. Now you may want to ask why. The reason is because prolonged use of this corticosteroid inhaler may cause oral thrush. So to avoid these side effects, you are required to rinse out your mouth after using this inhaler. Another group of drugs I may like to talk about are called the Leukotrienes Modifiers. So this drug acts by modifying the leukotriene. There are actually things that may trigger asthma in the body. So it helps to modify it, and drugs includes the montelukast and the zafelukast. They're usually said to be taken once daily. They help with the to reduce coughing in asthmatic patients. Another group of drugs I may like to talk about are called the long-acting beta agonists. Drugs like this include the formoterol, the salmeterol, the mometasone, and also the cyclesonide. This group of drugs are usually long-acting, and they help to reduce that bind in the muscle of the lungs, thereby improving the in and outward movement of air in the lungs. Another group of drugs I may want to talk about are the combined therapy. This is combination of both the long-acting beta agonists that I mentioned before and also the inhaled corticosteroid. So you can, or you may see combinations like salmeterol and fluticasone inhaler. That's 2 in 1. So they act by producing a long-acting effect, that's reducing the constriction in the bronchioles of the lung, and also help with the inflammation of the lung. We also advise at every use of this inhaler that you should also rinse your mouth to avoid oral thrush. Another group of drug I may want to talk about are the short-acting beta agonists, and those are the very common ones that we used. We call it rescue therapy. This rescue therapy, example, albuterol. Albuterol, also known as salbutamol. Salbutamol is used as frequent as one is having an asthma attack. It helps to release the patient immediately. This drug is short acting. That's the onset of action starts from even lower than 30 minutes. They are rescue rangers. That's it helps reduce the bind of the muscle in the airway. And note, they're also called bronchodilators, just like the long acting. But the difference between them is the long acting, from its name, it lasts for a very, that's the way it stays in the system, it lasts for longer hours than the short acting that may just stay for very few hours and the effect is gone. You may need to use it again. So another medical treatment I would like to talk about, which is very popular, is the theophylline. Theophylline helps to ease the chest and the lung, and also to aid breathing. They're usually long-term therapy, and you can actually take it once daily. They're usually done alone or mixed with another decongestant called ephedrine, or with an inhaled corticosteroid. Another group of drugs I want to mention are the anticholinergics. So this group of drugs are also bronchodilators, and they help to ease tightening of the muscle around the lungs. Example of this drug include the impratropium and the tiotropium. Impratropium can be found as nebules, which can be used in a nebulizer to help ease breathing, and you may also find it as an inhaler, while the tiotropium are usually found as dry inhaler. So the person may just tend to inhale the dry drug into the lungs. Another group of drugs I may want to talk about are the oral and intravenous corticosteroids. So these oral corticosteroids, which include the methylprednisolone, prednisolone, or the prednisone, are usually given to patients who are having severe asthma attacks. When I mean severe, that's they are having serious inflammation, and we want to reduce this inflammation to help their breathing. And these drugs are usually given for a very short period of time. They're usually given for 5 days to at most 2 weeks, and even when the drug is meant to be stopped, it has to be in tapered doses to help reduce its side effects. Now, while the intravenous corticosteroids are usually given only in the hospital, so when someone is actually having a severe acute attack, the person is given this in the hospital with a medical person by his side. It shouldn't be done at home. So the last group of drugs I would want to mention are the biologics, which are not so common in these parts of the world, but they are usually given to people who have severe asthma attack that are not being controlled by the previous medications that I mentioned earlier. And these drugs actually help by allowing the immune system to reduce the things or the allergies that may cause us to have asthma attack. They are usually given a shot. Patients are usually given a shot 2 to 4 weeks, either 2 weeks, every 2 weeks, or every 4 weeks. And drugs like this, for example, include the omalizumab, amongst others. So
There is a popular saying that you can treat asthma with dietary supplements. Let's know how true this is.
Okay, let me talk about it.
Okay.
It's popular. Like over the years, it's believed that Diets rich in vitamin C, vitamin E, and even omega-3 fatty acids, that they have a way of reducing the occurrence of asthma attack to some extent. But however, it has never been proven that if your diet is poor in this vitamin C, vitamin E, and omega fatty acids, that you're likely to have the attack more frequently. So in essence, I'm saying yes, it's important you have such diets, you take such diet, or you have food rich in such diets. But that doesn't necessarily mean that the absence or the low quantity of these diets will result in an asthma attack.
Yeah, and you should know that she has mentioned that the diet is not yet proven, the supplements are not yet proven, and you shouldn't say since you're on your supplements you don't need the medical treatment I mentioned previously. You must use your medical treatment to help you reduce the attack or the inflammation.
Thank you. Asthma in children, can it be overgrown?
Well, not in all cases. Yes, there are exceptional cases where we find out that a child had asthma attack from the onset, and over the years the asthma attack was gone. There are also cases when we've seen that from childhood there was no asthma attack, but after 18 years you find out that an adult comes up with an asthma attack. It does occur, but that does not mean that you can completely outgrow asthma.
Yeah, so I already mentioned, she said that when you take note of your triggers, what triggers your asthma, if you can actually stay away from those triggers, it will minimize your asthma attack.
Yeah, sure.
Thank you very much. There is a popular saying that you can treat asthma with dietary supplements. Let's know how true this is.
Okay, let me talk about it.
Okay.
It's popular. Like over the years, it's believed that diets rich in vitamin C, vitamin E, and even omega-3 fatty acids, that they have a way of reducing the occurrence of asthma attack to some extent. But however, it has never been proven that if your diet is poor in this vitamin C, vitamin E, and omega fatty acids, that you're likely to have the attack more frequently. So in essence, I'm saying yes, it's important you have such diets, you take such diet, or you have food rich in such diets. But that doesn't necessarily mean that the absence or the low quantity of these diets will result in an asthma attack.
Yeah, and you should know that she has mentioned that the diet is not yet proven, the supplements are not yet proven, and you shouldn't say since you're on your supplements you don't need the medical treatment I mentioned previously. You must use your medical treatment to help you reduce the attack or the inflammation.
Thank you. Asthma in children, can it be overgrown?
Well, not in all cases. Yes, there are exceptional cases where we find out that a child had asthma attack from the onset, and over the years the asthma attack was gone. There are also cases when we've seen that from childhood there was no asthma attack, but after 18 years you find out that an adult comes up with an asthma attack. It does occur, but that does not mean that you can completely outgrow asthma.
Yeah, so I already mentioned, she said that when you take note of your triggers, what triggers your asthma, if you can actually stay away from those triggers, it will minimize your asthma attack.
Yeah, sure.
Okay. Fam, you made mention earlier of oral corticosteroid. So how do we make use of those prednisolone?
Well, I mentioned like 3 of them because methylprednisolone, prednisolone, and prednisone are oral corticosteroids that patients are usually given to help reduce inflammation, especially when they are having severe attacks.
Children or adults,
yes, are given. So, but note, I also mentioned that they are usually given for short period of time. That's 5 days at max, 2 weeks, because of the unfavorable side effects you get from long-term use of these corticosteroids, especially the
prednisolone. Yeah, when you take prednisolone, for example, you are at risk of developing osteoporosis, and especially for people that have a genetic predisposition to diabetes, type 2 diabetes especially, prolonged use of prednisolone also increases your risk of developing this medical condition.
Yeah. So you also even get this redistribution of fat around the entire body system. So you could get a bit fatter, that's weight gain, in different parts of your body
Unevenly distributed.
Exactly. That's very key.
And so we should always remember that these corticosteroids, like the prednisolone we've mentioned, we don't just stop it abruptly, as she said. We need to taper the dose, and this actually means that we gradually stop the quantity or the strength of the medications we are taking over time. What we want to stop it, we don't just stop it abruptly. Gradually you reduce the dose and the duration at which you are taking this medication. This will help to minimize the side effects associated with taking it.
For example, it usually comes as 5 milligrams. So sometimes your doctor may tell you take 2 tablets morning, 2 tablets in the night. So if, for example, you want to stop the dose, the tapering means reducing it gradually. Instead of doing 2 morning, 2 nights, after some period of time, you can reduce it to 1 morning, 1 night, and probably reduce it to probably once a day, or then
and alternate between the days.
Yes.
You take today, you don't take tomorrow, you take the next day until you gradually stop it.
Yes. Thank you.
Thank you. Some people find it difficult to make use of the nebulizers. Please let us.
Another inhalers.
Okay, for that, I just want to talk about a nebulizer. It's actually a device that converts solutions to a mist form, so that it's easier for patients having this attack to just inhale and feel better. But I won't talk about it because we have so many inhalers, starting from the combined therapy. I want to get, or if you're confused about the accurate use of these devices, you could speak to any medical professional around you, or you could reach us at Asset Pharmacy on our WhatsApp 090-3455-3795.
Thank you. Thank you so much, our audience. For more information, you can visit our website www.assetpharmacy.com. Please like, comment, share, and subscribe to our YouTube channel for more health talks and information. Thank you. Bye.
Bye.